Next, we have another incredible complex group of patients, which I think is going to be helpful for all of us.
Thank you for an excellent panel for introduction. I'm Dr. Wong from the United Christian Hospital of Hong Kong, presenting my 6-month clinical outcomes data for STEMI patients implanted with DynamX Bioadaptor during primary PCI. So, again, my study is a single-center retrospective one, including 40 consecutive patients. It involved all comers with STEMI who were referred and accepted for PCI in the study period of 1 year from April 2022 to June 2023. And what makes it different from the Infinity Sweetheart or other large-scale randomized trials is that we did involve quite complex lesions there, as this is an all-comers trial. So we have 5% of patients suffering from left main diseases, and we have quite complex lesions in terms of the HA subtype. It's, more than half of them is the type B1 or B2 lesions, and 1/5 of them is type C lesions. And majority of them did have a bifurcation lesion, is up to 80%. The procedure success was achieved in all cases. We have a quite significant amount of thrombectomy used in our case of 38% because it's a pure STEMI setting. So the average device length was quite long actually, with 33 millimeters and device diameter of 3.3 millimeters. So as we have majority of patients with a bifurcation lesion. So here's a breakdown. On the right-hand side is a bifurcation treatment strategy here. Most of the cases, we did it professionally, while 1/3 of it, we protect the side branch with a shale balloon technique. And we did perform the double bioadaptor culotte technique in 6% of the case, which is an analog to the conventional two-stand culotte technique we have been using all along in DES. So here's an illustrative case of such techniques, who is a 58-year-old male, chronic smoker, unremarkable past health, who happened to be quite sick, suffer from anterior STEMI with severe LV impairment of 30%, ejection fraction, anterior hypokinesia. So here's the baseline angiogram. Basically, left main acute occlusions, very sick case, hemodynamically unstable, and we happen wire both LED and SIRT very quickly, and because it's obviously a Medina 111 bifurcation lesion or the left main bifurcation, we decided for culotte technique at this juncture, and then because again it's a STEMI setting, we are and so the vessel remodeling, the negative remodeling of the issues, thrombus issues is a problem. We decided to implant the bioadaptor in this case. So here's a 25/28 millimeters DynamX to left main and circumflex. We do first kissing, the 3530 balloon, and then we insert another 3523 mm DynamX to the LED in a culotte fashion to the previous device. Yeah, and then we did a second kissing. There's a double kissing culotte technique, and we did the second kissing with a 3530 balloon, and then port with a 4R5 NC. And then the key stand here on this rightmost panel, you can see there's quite excellent expansion of the scaffold, good coverage of the bifurcation, left main bifurcation area. So here's the IVIS of index procedure. You can see there's good bioadaptor expansion at the carina of the LED circumflex, and even at the distal short overlapping segments of the distal left main body. So here's the final angiogram, excellent flow to TIMI 3-fold to all vessels. So we did bring back the patient for follow-up angio for the stage procedure of other residual disease of the left coronary artery. Here's the 6 months and 15 months follow-up angio. We did end stage PCI to the mid to distal LED with another bioadaptor at the 6-month follow-up, and you can see that the face vessels in both follow-up are widely patent. The bioadapters are widely patent, and there's good flow down all the vessels. And here's the OCT follow-up. As you may remember, we did an IVIS and index procedures. However, when we brought back the patient for follow-up angio, we did an OCT in the 6 months and 15 months follow-up, which shows quite good neo-intimal coverage actually in all parts of the left main bifurcations with good endothelialization. Low significant neo-intimal hyperplasia, maybe a little bit here at the OCM of the circumflex, but the lumen is definitely fine. So here's the pulsatility check. We did a stationary OCT in both follow-up at 6 months and 15 months, and quite obvious you can see here there's some lateral is increasing pulsatility of the vessel, as evidenced by the lower panel here. You can see there's some lateral translational movement in the LAD, and even more accentuated in the circumflex here. So this case was simultaneously published in the JACC Intervention just 2 days ago, and we name it as the adapt Coulomb technique.
Very nice.
So back to the data of the trial, only 2 patients has clinical events through the 6-month follow-up. One of them happened to be a very sick case who suffered from cardiogenic shock, and his cardiovascular death was mainly attributed by the mechanical circulatory support complication, access site complication, which is not deemed to be device related. And the other non-target vessel related myocardial infarction is also not deemed to be device related. So ladies and gentlemen, this is our first single center report of bioadaptor implants in the exclusive STEMI setting with 6-month follow-up data. And only 2 patients had MACE events in our cohort, which happened to be unrelated to the device. So our study was in line with the big clinical trials that show promising data regarding the performance of bioadaptor, except that we did add further evidence in the regard of complex lesions like acute myocardial infarction case, bifurcation lesions, left main lesions, which is deemed to be more generalizable in a real-world setting. So that's the end of my talk. Thank you.
Thank you.